Good afternoon, children. So, in the last class, we were discussed or completed the topic until then. That means permanent methods. So, which is comes under the contraceptive methods, isn't it? We were also discussed about the both temporary and permanent methods. So, in this class, we will continue with respect to the topic, very important one, that is MTP, medical termination of pregnancy. Okay, so when it comes to the definition, how can you define the medical termination of pregnancy? It is an intentional or voluntary termination of pregnancy before full term is called MTP, or it is also known as induced abortion. Okay, I will repeat once again the definition for MTP: intentional or voluntary termination of pregnancy before full term is called MTP or induced abortion. Okay. See, as I said, the definition, of course, the intentionally, so they undergo, or voluntarily, they undergo the termination of the pregnancy before full term is called MTP, isn't it? Nearly 45 to 50 million MTPs are performed in a year all over the world, which accounts 1/5. That is nothing but if they become 5 persons conceived out of 1 of the total number of conceived pregnancies in a year, which is undergo MTP. Did you got it? If they 5 persons, if they become conceived, out of those 5, surely 1 person undergo MTP. Okay? Then, of course, MTP has a significant role in decreasing the population, even though it is not meant for the purpose. Remember, whether to accept or legalize MTP or not is being debated upon in many countries due to there are different issues like emotional, ethical, religious and social issues involved in it. Okay, and the government of India legalized MTP in 1971 with strict condition to avoid misuse of this MTP. Okay, such restrictions are necessary to prevent the indiscriminate and illegal female feticide. You know, traditionally, there are a number of people, they believe that if they get the male child, they feel very happy, they will celebrate. Okay, and if they get female, there are a number of cases nowadays also, especially the uneducated and the rural areas, they feel something different. Okay, and they will not give equal importance to the female. And earlier, before the government of India, legalized the MTP in 1971, the rate of MTPs were very much. Okay, so that's why only the government of India legalized MTP in 1971 with the strict conditions to avoid the misuse of MTP. Such restrictions are necessary to prevent the indiscriminate and illegal female feticide. Okay, if you would have went to the hospitals, especially the child care or the birth care centers, you must have observed that in the generally pamphlets or the charts, just like the identification of the feticides is, it is just like it will be considered as illegal. Okay, and it leads to the, that is, legal action, just like you must have observed the posters, isn't it? Yeah. Here, when it comes to the importance, why the MTP? the medical termination of the pregnancy, is it important or is it necessary? Yes. So, first of all, as I said, to avoid unwanted pregnancies due to casual intercourse or failure of the contraceptive used during coitus or rapes. So there are a number of cases. What will happen, as I said, to get rid of unwanted pregnancy, that is pregnancies, either due to casual unprotected intercourses. That means sometimes they may be planning for the contraceptives, or sometimes they may be planning for the future purposes. So before that only, sometimes what will happen, due to different reasons, unwanted pregnancies may happen. Okay, and it is may not only be we cannot say it is illegally may happen. There are sometimes legally only the unwanted pregnancy, that means pregnancy, may happen. In such a cases, okay, to protect as this, and as I said, even though there are a number of cases, they may be using the contraceptive methods, including temporary or the permanent methods. They may become conceived. Okay, in such a cases, also including, so you must have heard about, especially during coitus or the rape cases. So in such a cases, this MTP helps to get rid of the unwanted pregnancies. That is nothing but either due to the casual unprotected intercourse or failure of the contraceptive use during especially coitus or rapes. Okay, then, and very important one, it is useful in the continued pregnancies, which could be harmful or even fatal either to the mother or to the fetus or both. Okay, especially there are a number of cases. The children will be very small, within 1 year or sometimes within 1.5 years or not more than 2 years. Within that period only, if they become pregnant, they may be still not get recovered from the first pregnancy. So if they become the pregnant within that period only, it may lead to, that is a continued pregnancies, it may lead to the dangerous or harmful impacts on the mother and growing fetus. Okay, so in such a cases, this MTP useful in continued pregnancies, which could be harmful or even fatal either to the mother or to the fetus or both. Okay, so then, and here the remember, especially when it should be performed. Okay, when the MTPs are safe. When it comes to the safe period, MTPs are safe during the first trimester. That is nothing but MTPs are considerably safe during the first trimester upon to 12 weeks of the pregnancy. Okay, and the second trimester abortions are much riskier, which may be lead to the death also. Okay. So here the left side they have given the diagrammatic representation how they will remove, that is cut away view of the mother pelvis, and they will remove. Okay, yes, but the thing is, the medical termination of pregnancy, it is related to the number of various problems. As I said, the problems which is related to the MTPs, majority of the MTPs are performed illegally. Okay, especially in hospitals, the doctors are the trained physician, or there are number of cases nurses, they will do illegal abortions because of money. Okay, and you will not believe, while I was in the Bangalore, Okay, one of my friend, he was doing MBBS. Because of some, the issues, I went there. So I have, generally observed, I feel amazed also. There are a number of students, especially the degree students, they came for that is MBBS. You will not believe, but it is a fact. Okay, so that is actually, so how they will perform in these cases, those will be considered as there is a majority of the MTPs are performed illegally for the purpose of money. Then the misuse of amniocentesis test for the fetal sex determination. That's what I said. You must have observed. Generally, amniocentesis test should not be done. Isn't it? Government of India, it is restricted. But still, they are misusing the misuse of the amniocentesis test for the fetal sex determination. Okay, then what will happen, as I said, that is, if they come to know, that means if the fetus is female, it is followed by MTP. So that's what I said, because of different reasons. Okay, then, and such practices are dangerous for the young mothers and the fetus. Okay, so if they perform such a type of the MTPs due to continuous bleeding, sometimes the mother also will die. Okay, it is dangerous not only for the fetus, sometimes it is dangerous for both growing fetus and for the mother also. Okay, and so this question they can ask for 1 or 2 marks in exams also. What is amniocentesis? Okay, remember, in this, some amniotic fluid of the fetus is taken to analyze the fetal cells and dissolve the substances. It is used to test the presence of genetic disorders, survivability of the fetus. Okay, but actually, the whatever the liquid which is surrounding that growing fetus, they will collect. So this is having both advantages and disadvantages. The disadvantages also. Actually, it should be performed for the the identification of the genetic disorders to protect from the further problems. But the number of cases this test is using to identify the determination of the sex. Okay, so that's what the problem. Then if they find it is a female, the number of cases it is followed by MTP. Isn't it? That is a very big problem which is related to the MTPs. So this is the left side, whatever they have given. Okay. Next side, the Government of India enacted the Medical Termination of Pregnancy Amendment Act in 2017 to reduce illegal abortion and consequent maternal mortality and that is morbidity. According to this act, a pregnancy may be terminated within a first trimester, that is nothing but first 12 weeks, on the opinion of the registered medical practitioner, if they will be having a valid any reasons. Okay, if there will be no valid reason, it may be leads to the legal action. They may be sent to the jail also. Okay, if the pregnancy is between 12 to 24 weeks, two registered medical practitioner must be that is, they should take the opinion. That is, a second opinion is also required. Okay, of course, the recently so government is also amended this is also, because there were number of cases. In the beginning it may be look quite natural or the normal, but later days, if they come to know the genetic disorders or any problems related to the abnormal growth, or sometimes it may be loads, which may be leads to the growth maybe is also not proper, that is unusual. So then also it may be leads to the MTPs only. Okay. fine. So after this one, let us discuss. There is another important topic, STDs. What is this STDs? Sexually transmitted diseases. Okay, short form they are considered as STDs. Okay, so these are also some of the symptoms they have given in the slide. What is STDs? Sexually transmitted diseases. The diseases or infections which are transmitted through sexual intercourse with an infected person are collectively called STDs. So generally it will transfer from, that is, infected person to the healthy persons. Okay, as I said, the diseases are transmitted through the sexual intercourse are called sexually transmitted diseases or infectious. Okay, so that is STDs, but it is also known as STIs, sexually transmitted infections. It is also known as venereal diseases, which may be leads to the death also. If we take an example of AIDS only, it may be leads to the death. So that's why they are known as venereal diseases. Okay, so which it is especially in some cases, if they don't take the proper the treatment in the beginning, so surely it may be leads to the death. That's why. Then there are a number of cases. It is the reason behind the reproductive tract infections. Okay, yes. Examples. Here there are a number of examples they have given with symptoms of the diseased peoples. That is syphilis, gonorrhea, genital herpes, genital warts. These are some of the examples. Okay, so sometimes they will ask one mark questions also. Give the examples of STDs. Then you should write some of the STDs are as follows: gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, even trichomoniasis, hepatitis, and AIDS. So these all comes under the sexually transmitted diseases. Okay, and generally how these STDs transmit. Okay, the mode of transmission. Generally, the hepatitis B and HIV are also transmitted. Remember, in number of cases, the mode of transmission, the word itself indicates the sexual contact with infected persons, that is, unprotected sex with an infected partner. Okay, and the second one, very important one, sharing of injection needles, surgical instruments with infected persons. So this is number of cases. It is happens the drug addicted peoples, they may be sharing the injection needles and surgical instruments for the purpose of the infusion of the drugs. So then they may be not aware that much all those things. They don't bother or care about all these things. While if they are get addicted especially, so then it will be sure that STDs will transmit. Then transfusion of the contaminated blood. There are a number of cases. What will happen? Sometimes it may be different reasons are necessary also. In emergency cases, without the check, they will take a blood or they will transfuse. In such a cases, there are possibility of the infection is very high. Okay, the infection from the blood products. And another one is STDs can also be transmitted from infected mother to the growing fetus. Okay, so this is very important knowingly or unknowingly, willingly, or unwillingly. If they undergo such a type of the problem, surely they will face such a type of the problems. Okay, yeah. So let it be. So next class we will continue the remaining things. Okay, fine. Thank you. Have a nice day.